So today I'm going to be performing trach care. So the first thing I would do is I would verify that there's a reason for me to be performing the care. If my patient had a new tracheostomy, I would come in 30 minutes before the procedure. I would identify their name, date of birth, and their medical record number, because if they are unable to speak, I need 3 forms of identification. I could also verify that with their medical record if they were unable to speak. So the next thing I would do was I would be to assess their pain level. So that could be on a scale from 0 to 10. If they were in any pain, I could administer pain medications to them, and I would document that in the MAR, and then I would come back 30 minutes later to perform the procedure. So before all of that, I would come in, like I said, and verify my patient. And then I would assess their respiratory status. So are they having any difficulty breathing? I would auscultate lung sounds anteriorly and posteriorly in 6 places on both sides. I would check their pulse ox, their skin color, and the rhythm and the depth of their breathing, if they were in any distress, and that they were okay. So then, as I mentioned, I would administer the pain medication, document that. I would put my drape over my patient. So this is just a clean drape. And then after that, I am going to put on my PPE. So now that I have my PPE on, I'm going to go ahead and I'm going to start the procedure. So I am going to make sure my patient is in high Fowlers or semi-Fowlers, and if they were unconscious, I could turn them laterally towards me. And then I would explain the procedure to the patient. So I'm going to get my supplies ready here. So take this. Be careful not to touch the inside. I'm bending that back. So I'm going to take my sterile gloves out, touching anything, placing them over here. And then I'm going to take my sterile drape and place that down, making sure I'm not touching the inside. Okay. So next thing I'm going to do is I'm going to take the supplies and I'm going to dump them onto my sterile drape. Okay. And then I'm going to set this back down. So now I'm going to fill my container here. First one is going to be half hydrogen peroxide, half normal saline. So when I have my normal saline and my hydrogen peroxide, first I'm going to check the expiration date, and then after I open my normal saline, I'm going to write my initials, the date, and the time, because it's good for 24 hours. So then these 2 containers I'm just going to fill with normal saline. And then I'm going to get clean gloves on. My hands are washed. So at this point, I've been back into the room, knocked on the door, washed my hands, and I identified my patient again. I reassessed their pain level, and I'm starting the procedure. So get my clean gloves on. So I verified all 3 things on their armband: the medical record number, the birth date, and the name of the patient, and reassessed their pain scale. So I'm going to remove the oxygen source, set that to the side, and now I'm going to remove the inner cannula holding the faceplate, which would be here, but for these purposes, rotating clockwise and pulling out, holding the outside, and then I'm going to set it in my hydrogen peroxide. So after that, I am going to reapply oxygen if they need a few breaths. And then I can take off the gauze pad. So after I take this off, I am going to note the coca, the color, the odor, the clarity, and the amount on here, and then I can throw that away. So my patient has their oxygen back on. So now I'm going to clean the trach, the inner cannula. So I'm going to take off my clean gloves, throw them in the trash, and then I would hand gel and re-sanitize my hands. So now I'm going to get on my sterile gloves. Okay, so now I'm going to come over and I'm going to clean the inner cannula. So I'm going to make sure I'm only holding the outside. And I'm going to take my pipe cleaner. And I am going, for purposes of the video, to take this out but pretend like it's still in there and it'll be thicker. So I'll clean the inside of it, back and forth, and then once it is in there, I would clean the outside as well, getting off any secretions. So in this I can throw away. I'm going to take this and I'm going to dip it in the normal saline and get it all cleaned off. And then I'm going to take one of my 4x4 gauzes, and I'll take my pipe cleaners, and I'm just going to clean through and make sure that it's dry all the way through. Okay. So then this came undone, but I'm just going to do it. So now I am going to remove the oxygen source, and I'm going to insert it at 9 o'clock, twisting it to 6 o'clock, and I would secure and make sure that it's locked in, and then I'm going to reapply the oxygen. So now I'm going to remove the oxygen because I'm going to apply, start cleaning the faceplate. So the normal saline that I have not used yet, I'm going to dip it in there, and I'm going to clean from the center outwards. Center outwards. And then I'm also going to clean the faceplate. Clean the faceplate. Clean it. And then I'm going to take my dry 4x4 gauze, using a different corner each time. I'm just wiping underneath, different corner, just making sure it's dry. So now that's dry, I'm going to give my patient back oxygen. So next thing I'm going to do is I'm going to reapply the dressing that goes underneath the faceplate. So I would reapply that. So I would never, in the hospital situation, cut a gauze to fit around there. I would always use the pre-cut ones because you don't want any of the fibers getting into the airway. So lastly, what I'm going to do is I'm going to put new trach ties on. So when you put the new trach ties on, you don't want to remove the old ones first. You want to start with putting these ones on. So if this was a faceplate, I would be tying it into there. Double knotting, but making sure that it's not too tight, that I can at least fit 1 to 2 fingers underneath of there. But that it's also secure enough, keeping 6 inches longer. And I'd come around to this side. So when I'm tying this, I want to tie it around the patient's ear. Double knotting, making sure that I'm not near the carotid artery. And then again, I would assess to make sure my patient is comfortable and that they can move their neck freely, but it's still secured. And then I would remove the old ties following that, and my patient has his oxygen on. So now my patient is all cleaned up, trach care is performed, and so I would remove my gloves, the ties would be removed, and this doesn't have any secretions on it, so my hands are fine to touch it. That. I'm going to clean it out, and I put my patient in the lowest position, make sure that the bed is locked, that they have their call bell in place, and then I would wash my hands, and I would document that I performed pre and post respiratory assessment. I would perform the respiratory assessment on them after this was all done, and I would listen to their lung sounds again. I would monitor their pulse ox, take a full set of vital signs, assess their skin color and their respiratory rate and their depth, see if they were comfortable in any pain. So then I'll document that I had performed the pre and the post-op or post-trach care respiratory assessment. I would document the COCA of the first gauze that I removed, so the color, the odor, the clarity, and the amount that was on that. I would document that I performed trach care and how well the patient tolerated the procedure, and I'd be good too. I'm documenting the condition of the skin underneath the faceplate.